I'm with Dr. Lorrin Pang from the Department of Health here in Maui, and Dr. Kirk Milhoan, who's seen many patients who are suffering or in the beginnings of what we're calling COVID Delta variant. So just to summarize, Dr. Pang, can you talk about, just for a few minutes, what is different with Delta and why, because what is different with Delta, there is a kind of an urgency to consider early treatment? And then, Dr. Milhoan, what is your experience with early treatment and what are you recommending?
Okay, so COVID has a new variant called Delta. It had spread very quickly, but as an entity, it's more rapidly, it spreads to more people in the same amount of time, maybe 2.6-fold more. So since we see more and it's more severe and the vaccine might not hold or protect about it, we're going to have more. And so now our next fallback line is early treatment. I have preventive medicine, but don't forget, or you might not know, preventive medicine means prevent the disease or prevent the severe forms, which means early treatment, or even once they're severe, prevent the complications so the guy's not like crippled for life. So in my malaria work, we do prevention and we do early treatment. We probably did more early treatment than prevention. So we'll leave it at that. And Kirk, you can talk about early treatment because we're going to have to step that up.
Yeah. So first, how do you know you have COVID or you should get tested? Some of the early signs right now for any upper respiratory infection where you're having runny nose, you might think it's allergies, you might have a scratchy throat. That's probably what I'm seeing first. It starts with a scratchy throat. Then usually a headache comes along, and then they might have some runny nose. And from there, it usually develops into a sense of fever, but when you take your temperature, you don't have a fever greater than 100.4. That's our standard for what we call a fever. And then the aches and pains start where your body aches, and often people describe it as that's what it felt like when I had the flu. And then you may develop a cough. Early stages, I'm really encouraging people to get tested early, and because I don't want to delay early treatment. One of the beautiful things we have on the island now are antibodies that are. It is an outpatient infusion of antibodies that neutralize COVID and have a great response. I have a number of patients who've gone through this, and I've been very impressed how mild their disease was after that. The other things I would like to encourage people to do is there's some nutraceuticals, things you can get over the counter. One is quercetin, and that works with zinc to inactivate virus and decrease its potency. Vitamin C and vitamin D. There have been beautiful studies to show that hardly anyone who had normal vitamin D levels ended up in the ICU. It's a very important component of our immune system. And then if you do receive the diagnosis of COVID or someone believes you have COVID and enough to treat, then there are a number of different options. This is put together primarily by Dr. Zelenko, Dr. McCullough, and the frontline critical care doctors. You can look up all of their treatment strategies, but basically it starts out with what I said before, the quercetin, the vitamin C, the vitamin D, and the zinc. And then you would add 2 anti-infective agents, one that is specific for COVID and one is really to protect your lungs. So it would be hydroxychloroquine or ivermectin, and that would be paired with either azithromycin or doxycycline. If you progress from that, if you have more symptoms from that, specifically respiratory issues, then we usually add a steroid after that. This is not something we just treat you with and send you home. This is a daily follow-up with the patients that I'm seeing. And if I'm seeing any respiratory symptoms at all, then I want to do a pulse oximetry at home to see what their oxygen levels are to make sure they're not really becoming in an acute stage. What people can expect if they have the mild form, it's 5 to 7 days. If you have the more severe form, it's lasting from 7 to 14 days. And usually if you're needing hospitalization along that way because of oxygen or other complications, then that is usually a severe form. I'm usually seeing that at about 14 days. The other thing that I think is very important, what I think of how we can protect each other, is if you're sick or you are in a home with a lot of people who are sick, avoid as many activities as you can. Okay? Stay at home. Let other people shop for you. Stay out of busy places. I think that is probably the best thing that we can do each other. And I know it goes back hundreds of years. Basically, if you're sick, stay at home. All the other things we're trying to do have much less effect than if we can keep people who are sick or in a household with sick people to stay at home. So that to me is right now the most important public health preventive measure I have, and then the nutraceuticals, and then early treatment.
So can you make any distinctions between children, elderly? Is it all the same for all the demographics?
It's very, very specific that it really it is much tougher on the elderly and those who have specific comorbidities. Obesity, diabetes are those that, so elderly, obese, and diabetics, very tough on them. What I have not seen is a lot of severe disease, and I'm also on the mainland in a children's hospital. I do not see a lot of severe disease in the young. It's very rare. So I have much less concern. I don't treat young children. I usually, if I'm going to start treating people for disease, it would be starting in the high school age. That's the earliest I've treated. I've seen in many young children whose parents were positive, they eventually tested the children, and the children were positive, and those children usually recovered in 2 days. And so what I like to do is stratify risk as best I can, and that tailors therapy and how closely I watch them and how much follow-up they get. But I do stratify for age and comorbidities.
Okay, well, thank you. So in closing, people are getting the messaging from the government daily that the best thing you can do is go get vaccinated, over and over again. But I have heard that in the middle of a pandemic or in this particular situation with Delta, that maybe that's actually not advisable, and that could even be dangerous. Could either of you just speak to that? Like, should people be running out and getting the vaccine now as to prevent them from getting Delta or spreading Delta?
I think there's no question from the UK that the efficacy, how good the vaccine works against old COVID was pretty fantastic, at least against severe, 97%. Against mild symptoms, it had to be like 90 to 95. And then we never tested it for transmission by asymptomatics, fine. Old COVID. Now against Delta, if you actually, who got the most data on it? The UK. It's not so good against severe. I looked at their data. To me, it looked like 70%. It dropped from 97 to 70. But the Americans say, well, maybe it's 80%, but it ain't 97 for severe Delta. Then for mild Delta, the ones he's trying to pick off, it used to be against old COVID, maybe 90, 95%, but it dropped to 80%. Nonetheless, it's still good. I take a vaccine if it was 65% effective, but it's not as good as it was, okay, because it's Delta. And I think the more honest we are about what it is, because we're supposed to give a fair, informed consent, we're supposed to say how the benefits, how it works against Delta. And rather than just say, well, it's still good, that not quite, it upsets the public, it upsets me, because you keep saying it's still good, still good, still good. And then all of a sudden, hey, we got the booster ready. And the next time you tell us we need the booster, it's horrible. Can you please describe as it falls so we can prepare and do something? Right now, it's still good, better than nothing, go, before it fails hopelessly. But that's why we plan the booster. So you get these funny mixed messages here. And when we give informed consent, I expect it to be quantitative. And I expect it to be, if we don't know, we say we don't know, okay? So that's why I still push the vaccine while it still works and it still protects.
I think the data, like when I look at UK data, the last I looked at, when you looked at patients who were under 50, they had 265,749. The deaths were 71. That was a 0.026% death. if you're greater than 50, it was 33,736 deaths were 670 at 1.99%. So we're looking at about 98% survival for those who are over 50. If you average those all out, the death rate is 99.8, or the survival rate is 99.8. Fully vaxxed, they had 47,008 deaths, which was a 0.855%. And for unvaxxed, they had 151,000 and 54 deaths, and the deaths they had were 253, which was 0.16. So I think that the data is all over there. I think we'll see how it all works out. I think even if you get vaxxed, though, whether you're vaxxed or not, if you're sick, stay home. That's what I would say. That's what I would say.
So
and I think that we should also risk stratify. I don't think this is a one thing fits all. Personally, I'm not worried about the children. That's not what I'm seeing in the community. What I'm seeing, if I were to stratify who are the highest risk, when I see an inflection point, it's about 40 years above. They're using 50, other people use 60. I'm just saying what I'm seeing is 40 year for Delta, 40 and above is an inflection point for me. But the younger than that, I'm personally more of a fan of natural immunity, especially when risk is really low.
So risks of the vaccines aside, because in informed consent we have to talk about the risks of the vaccine, both known and unknown. But the benefits, Dr. Pang, feel that there's still maybe some benefit for people to go get the vaccine now, is that right?
Yeah, we haven't talked about a topic. We deferred it for later, but there's long COVID. Mm-hmm. And so no one really knows how to prevent it. So in other words, if you have a vaccine against Delta even, and you prevent severe or mild symptoms, did you just convert it all to long COVID? So you didn't really decrease the amount of long COVID? Nobody really knows. So tell me now, does a vaccine help against preventing long COVID? Honestly, we don't know. It might be, it might not be, but it is a big problem, long COVID.
I think that, going back to where we started here a couple of, weeks ago, I think that there are people who are very thoughtful who can disagree. Right? But when very thoughtful people disagree, maybe that's not the time for mandates. Maybe that's the time for allowing people to decide. Right? I think that would be my feeling. I think part of this is we're going to have to wait and see who was right and who was wrong, and we might take couple of years. It might take 10 years. We might have to wait to see what happens when young people who got vaccinated at age 12, what it looks like when they're 25. These things happen. We have to see how things play out. We don't know. Right? I mean, we have to be honest. Like he's very honest. We don't know. Will it help? Won't it help? And so I think that in this situation, we're being as honest as we can, Dr. Pang and I. I love to have discussions with him. I learn from him. Do we see everything exactly the same way? No, but I've never been around other scientists. We always see everything, right? That's good things about scientists. We should always be sort of having this discussion. What concerns me in our environment is I hear one narrative and you have to stay with the one narrative. And if you don't stay with the one narrative, then you get name called. Right?
Got it. If I could summarize what I think you both agree upon, and let me know if I'm wrong on this, and maybe we can wrap up with this, that I'm hearing from both of you, there's a lot we don't know, particularly with Delta, and we can't assume that it's like the previous versions. And that you both agree that, particularly with Delta, early intervention is really, really important.
Yeah.
So, and that we should probably discuss next week what we're learning, and maybe we know more, maybe we have more questions. But I really, really appreciate you both taking the time and sharing your expertise, both from your perspective, Dr. Pang, in the Department of Health, from your perspective in the streets, treating people, and I hope all right, wherever you are, I hope we can do this again next week. I hope things get better. Give people hope, and we will have links to what if people want to follow up and get some more information or get access to some of these early treatments.
I
Yes.
promised the Department of Health I would say I speak as a private citizen. It's not that they disagree. I just don't quite know their full position on these things. So I don't know if they agree or not, but I speak as a private citizen.
Great. Well, appreciate you being here. And now we're going to take some questions. So thank you.